like, how do you choose an orthodontist?
All right.
Like, how do you understand or ensure that the person who is treating you or is getting you the treatment is the right person? So
Cleft is something like, cleft is a defect. Children are born with it. 1 in 800 to 1 in 1000. That is 1 in 1000 children in India are born with deformity.
it's not very rare occurrence.
It's not very rare because especially in South India, you have a lot of these deformities. It's usually the upper lip is not joined. It's not joined. So cleft care is not one person therapy. It is like once a child is born with cleft, the mother is pretty distraught. So there are a lot of individuals who are born with cleft and have become very successful individuals in their lifetime. So it's nothing like, it cannot be treated. To have really good dexterous hands, you need to be an artist to become a dentist. And that's perfect. It's a dental artist. See, braces have been a long time. And now braces have been traditionally cheaper. Aligners are customized. Once it's made for you, it will not fit anyone else.
Okay.
One of the reasons why it's caught on is because it is non-intrusive. In the sense, nobody will come to know that you have worn aligners.
Okay.
Especially, and it gives you the freedom to eat whatever you want. In braces, you don't have those freedoms.
So you can eat even with the aligners?
No, but you have to remove the aligners, eat your favorite hard food, no problem.
Suppose you want to set up your own clinic, so what kind of investments would that take?
That would probably for the starts, about 5 to 10 lakhs.
Okay.
Maximum maybe 20 lakhs. Because orthodontics is one field in dentistry where a lot of physics is involved. Because of moving a tooth, orthodontics is about moving a tooth. It requires direction, which direction, how much force, and all those things are involved in.
Now, you being an orthodontist and been practicing for last 20 years, how much money does an orthodontist make?
Okay.
In a year?
That's like a googly you put now.
So, thank you for coming to the podcast.
Thank you very much.
Inspire with me, Pratik Bhai.
Yes,
the
really
first
excited.
time we are shooting in this studio. How do you feel?
Oh, actually, it's a great setup. And in fact, I'm already feeling pretty cozy about it. And really looking forward for a great podcast.
Thank you. Actually, just a disclaimer. ये मामा भांजे वाली discussion है. So, Dr. Gajanan Shanbhag, he's an orthodontist. He's the first cousin to my mother.
बचपन से देखा है.
बचपन से देखा है. But the last time we met, I believe he's saying it was in my marriage. It was 10 years ago.
Yes.
It's been a long time.
A lot. Time
but
flies.
It is great to have you back.
Absolutely.
See you actually and have this discussion with you because I believe there are a lot of people around us, especially क्योंकि ये जो podcast that I have started, the whole agenda was to create awareness about all the industries, all the people who have created a name for themselves, who created a brand for themselves, and understand how have they achieved it. So,
actually, it's a very great initiative, and it's a very novel idea.
Thank you.
And I'm sure you'll really do well in this.
Thank you. So just a trivia for me. We call you Chetan Mama.
Yes.
And you call yourself Dr. Gajanan Shanbhag. Why?
Yes.
What is the difference? I mean, why two names?
All right. So basically, I was born on a Ganesh Chaturthi. And that's the reason they named me Gajanan, obviously.
Okay.
And then I think there was a debate among mom and dad. And somebody wanted Chetan and then somebody wanted Gajanan.
Okay.
I think before that, dad went and, kind of made my name official as Gajanan Shanbhag.
Oh.
So Chetan was about stuck as a pet name, and then Gajanan is what we went by the official name.
Right. Because I mean, I have been fondly calling you Chetan Mama all these
all
years.
The family members in fact.
And recently, I mean, I did know, but I just wanted to put this across you because I now have this power to ask you that question in front of everybody, right?
In fact, when somebody calls me and he say, okay, Shanbhag, Gajanan, that means it has to be a friend or a patient. And if it's Chetan, it has to be a family member. So that's how I differentiate somebody from the family of somebody else is calling me.
So just tell me one thing, how life has been. I mean, you started your career as a BDS, then you did your MDS.
Correct.
Now you specialize in cleft and aligners.
Right.
So, how is this journey been for you? Can you give us a brief about how did it go and how things have evolved for you?
All right. So, I mean, growing up some way back in 1992, when you're in 10th standard, you are always that time it was a fad. You'll be either going to engineering or you'll be either going to medicine. And in fact, even till today, I think it's still broadly classified as like, when we are going to go into the science stream, it has to be either engineering, it has to be medicine.
Right.
So, I mean, 10th and 12th, I think I was pretty much sure, ki I wanted to go for medicine. But obviously, tabhi MBBS mila nahi. So, we are all like the persons who like MBBS reject and then I got into dentistry. And somebody told me, "Arey, dentistry is good. You'll make a lot of money. You are in the right time. This is dentistry is booming at 1994. It is going to be the branch of the future." I said, "Okay, not bad." So, that's how I ended up in dentistry. But believe me, I think that is a good choice.
Okay.
Life has been really great.
Okay.
And I did pretty good for myself as well. Dentistry is a branch where, it's medicine, as it's a medicine skill, plus you need it's kind of artwork as well. You need to have really good, dexterous hands. You need to be an artist to become a dentist. And that's perfect. Is a dentist, dental artist is a dentist, something like that.
Okay.
So, I was really good in, creative things like building things, like drawing, artwork. I liked it. So dentistry came as a perfect marriage where I could, pursue my career as well as like doing things which I liked doing. So that's how I ended up being a dentist.
Okay.
And it's been a fantastic journey so far.
There's always been a debate. I'm not sure. Most probably you most likely have been. Sanket.
Yeah, of course. Yes.
My first cousin. Yeah. Even he's pursuing dentistry. Now he has done his MD and into oncology. Right. But we don't call him a doctor.
Of course, because you grew up together. Obviously.
Exactly. Yeah. So, how do you face that thing and how have you tackled? Do you feel bad or like have you taken it up?
As in somebody calling out my first
dentist,
name? Sorry?
No, they normally don't call a dentist a doctor, right?
Okay, right.
So how do you take that up? Do you feel agitated about this? Ki kya hai? Why is that being so always like ki dentists are not doctor, but definitely it's a medicine profession and you've been doing the same kind of years in the college like a normal MBBS doctor. So how do you what was your experience about it and how did you tackle that?
All right. So I'll throw some light on this. Now, see, the dental subjects in the third year, you are studying anatomy, but yes, anatomy more so focused at the head and neck region, not the complete body anatomy.
Right.
But you study the head and neck region thoroughly.
Right.
Absolutely thoroughly.
Right.
All right. And except the neuro part. But then, and after that, you had in the other subjects are pretty much common, what we share with the MBBS. Of course, the MBBS in much more depth. The dental curriculum as such is focused as what all a dentist would require to face the daily life challenges and daily life situations.
Right.
Okay, so we are not really going in depth of neuro or any other anatomy per se. And then you are also trained in the basic physiology, the basic medical subjects as well, as medicine and surgeries.
Okay.
Again, it's not in depth, but what all is required, you'll sail through for that. Okay. Right. And obviously, when it's really the complicated medical situation, you're not expected to intervene as well.
Right.
All right.
Yeah.
So, per se, yes, the government of India recognizes you as a doctor.
Right.
Having said that, in US, if you say you're called on first name basis, like Mr. Brian, he might be Dr. Brian, he might be they called Mr. Brian or Mr. Bob.
Yeah.
Here, dentists are called doctors.
Right.
However, we are trained to give basic first aid emergencies.
Okay.
We can handle those emergency situation. A basic first aid, we can do CPR. We are trained. Some people, some of the specialties are trained in giving IV injections or intramuscular injections as well.
Okay.
So, yes, the government recognizes a doctor, but we certainly don't take offense if you're not called a doctor. Okay.
Well said, sir. So my next point to you is, now that you mentioned, like in BDS, you learn the basic stuff and then obviously the more specialization in the third year and the fourth year.
Right.
But ideally, that is what even you have done. You have done an MDS.
Right.
Similar to what Sanket is doing in oncology.
Correct.
That's why I know more about this subject because he's in Mumbai and now I've been talking to him and I understand this industry a bit more in depth, right?
Correct.
So normally, what all things does BDS doctor can pursue when he is pursuing MDS?
All right.
And now that you've taken orthodontist, why was that choice?
Okay.
What made you choose orthodontist as a subject of specialization?
So, this is a very good question. I'd really like to answer. Now, a lot of laymen would know, but then Dentistry has 9 branches.
Oh, is it?
Yep.
Oh.
It has 9 branches. And one of the branch is orthodontia, which I am doing.
Okay.
So why orthodontia? Now, say in the BDS, we had this subject orthodontics, but of course it was like on an undergraduate level. So for post-graduation, you have to do another 3 years.
Okay.
Then you become a master in dental surgery.
All right.
BDS is a 5 years of course, that is basic undergraduate. You're doing 4 years of course, 1 years of internship. And then post that, you're doing another 3 years of post-graduation.
So almost 8 years.
So after 8 years, you become an MDS. Undergraduate is BDS, Bachelor of Dental Surgery. After undergraduate, another 3 years, that becomes Master of Dental Surgery.
And you don't you need to do some kind of fellowship or internship after your MDS?
No, there is no fellowship after MDS. There is no internship after MDS. There is internship after BDS. That is first 4 years of BDS.
All right.
You have 1 year of internship. That's 5 years. Then another 3 years of post-graduation. That's MDS.
Okay.
So after the MDS, it's up to you where you want to hone your skills. You can go for specializations, fellowships, observerships. You can internships abroad.
Right.
And it's only building on your capabilities and earning those skills so that you really specialize and go in depth into the science.
Right.
So in the undergraduate level, we had a subject orthodontia, and it involved a lot of we used to bend wires and we used to twist wires. It's not really liked by many because you have to really make shapes, circles, loops with wires. All right.
Okay.
But then somehow I was really, really good at it.
Oh, nice.
Yeah. As I told you, because in the school I was really good in craft, art, science, and tinkering with things. I'm still do tinker.
I know that.
I still do tinker with things.
Yes.
And at the bottom of my heart, sometimes I feel I should have been probably an engineer or mechanical engineer, but maths was my nightmare, nemesis.
Okay.
So that is an obvious choice for me because I could really tinker with those bending wires and making objects, and so that was I think most obvious choice for me, becoming an orthodontist. And sure it was.
Okay.
Because orthodontics is one field in dentistry where a lot of physics is involved.
Okay.
We study about vectors, we study about forces, motions, and we study about center of resistance, and we study force and moment and all those physics terminologies. Because of moving a tooth, orthodontics is about moving a tooth. It requires direction, which direction, how much force, and all those things are involved in that.
Right.
Okay, so in that sense, it has I think a perfect fit.
Okay, great. So good to know that you chose a career profession that you actually liked.
Yeah.
Because like you said, you had inclination toward arts, and this, as you mentioned, requires skill and art both to set your teeth or your smile corrections. What an orthodontist primarily does, right?
Correct.
So just to have more clarity on what all things an orthodontist can take care. So you have just wanted to understand. So braces and smiles, right? So you are the owner of the company,
right?
So how many branches does this company have at this moment?
Okay, so it's got a small story, in fact, if I may.
Yeah, please.
So I started my practice immediately after, somewhere around 2004, that is after passing out in 2003. And for a long time, I was solo, in the sense, solo practice. And then during the journey, so many years, we made friends.
Okay.
So I had this idea of in the sense, that we should have like-minded people like me, like orthodontists, who should come up together, have a single brand name, and then go ahead and market that brand name. All right. So what happens is the resources divided, the expenses are divided, and plus we have 3 of professionals working together. So that's a lot of it brings in a lot of opportunities as well. All right. And simultaneously, one of the other friend, who's Dr. Viren Puri, he had an idea. And then there is this Dr. Rajesh Patil, who is also AIMS graduate, in fact.
Okay.
And then we all, Dr. Viren and Rajesh happened to be batchmates.
Okay.
So we got together, and then I think this should work. And 2012, we got together. We created this brand.
Okay.
And so far it's been going on good. Now it's been 12 years.
It's been like almost 12 years.
That's right. And we're
don't
still
you think
together.
This was like way too early before all this franchises models and all the stuff came in?
It's very different. It's not even a franchising model. It's so like 3 different clinics maintained. run by orthodontist. The orthodontist himself owns the place. The
Oh,
orthodontist
nice.
himself treats in the clinic. We are India's first braces chain.
Oh, really?
Yeah, it's not even a
Wow.
franchising model.
Oh,
It's
this is something I didn't know. Okay.
we own the places and we operate the places ourselves.
Superb, great.
So that's how it's.
So
a
how
little
do you
different.
plan to or have that intention to grow and expand? Do you have any expansion plans for the same?
Certainly. We always been toying with that idea.
Okay.
And in the near future, I think that should see the light of the day.
Okay.
What we are doing right now is we are also kind of training the next franchisee. We need quality control,
True. Right.
So we need those people to be absolutely our clones.
Yeah.
All right.
Understand. Yeah.
So we are taking up that, and we are kind of training the next generation of people who are going to possibly look into those future branches.
Mm-hmm.
That's definitely in the plan, but it takes a lot of time.
I understand. Yeah. This is one thing I always wanted to ask you. Like, you did your MDS. So, like, you and I have this discussion with Sanket most of the times. Like, what is your future plans? Do you want to start off something of your own? Yeah, you'll end up in a hospital as a doctor who's on a visiting basis. So, how did you start your career after your MDS? Like, did you start something of your own, or did you start working with in a private hospital as a consulting doctor, or how did that start? I mean, how was that journey before the braces and smiles?
Correct.
What was your journey like?
So before from 2002, we passed in 2002. For 2 years, I was working as a consultant, going in different places. I also had an hospital attachment, hospital attachment that's called as BSCS Hospital in Andheri. And where it's a very good cleft center. They treat children with cleft deposit. They used to. That center is shut down now.
I'll stop you. What is cleft? I mean,
all right,
so that the audience will have more clarity.
You should know that. Okay, so cleft is something like, cleft is a defect. Children are born with it. 1 in 800 to 1 in 1,000. That is 1 in 1,000 children in India are born with this deformity.
It's like a common. It's not a very rare occurrence.
It's not very rare, because especially in South India, you have a lot of these deformities. And 1 in 800, 1 in 1,000 children are born with cleft. Now, what does happen? It's usually the upper lip is not joined. It's not joined. The upper lip portion is not joined because that lip portion is missing. It's a birth defect.
Okay.
Not only that,
That's
you
sad.
go inside, the upper jaw, some portion of the jaw is missing.
Oh.
All the way to the palate. So these
Palate as in?
Yes, the palate is a soft palate, the upper roof of the mouth.
Okay.
Even that has got a small defect. That means the roof of the mouth is separated. So in other words, if the child is going to drink milk or suckle on milk, it can actually go into the nose.
Oh.
So these children have a lot of challenges, from feeding to speech, and in the future, the teeth also get crooked. They have jaw deformities. They may be associated with ear defects and other syndromes. So yeah, it's pretty challenging to work on these children. So during my post-graduation in MDS, this college in A.B. Shetty, Mangalore, it's one of the busiest cleft centers in India. Okay, one of the busiest. And we had a cleft center there. So I thank God for that training, because we are really pushed into it. Like, we are like thrown into the water, now go swim. That is the kind of training our teachers taught us. Fend for yourself. If you are in trouble, shout us out and we'll try to bail you out. But you have to make an effort to swim. And it was really good. It was intense. We used to really work beyond the college hours. And this being a cleft center, so we were exposed to a lot of these deformities. So we were trained really well to handle it. So one of the professors happened to open, I'll name him Dr. K. Shamrao, who happened to open this center in Mumbai, that is BSCS. And since I knew him, he said, Dr. Shanbhag, why don't you come on board? And I said, happy to be. So that's how the connect happened. And, I became a part of the BSCS Cleft team. That center is shut now.
Okay.
And now it is shifted to Holy Spirit in Andheri East.
Okay.
So, but the organization has moved from BSCS to Holy Spirit. But I'm still a part of the Cleft team.
So you have been working in cleft care I think since 2004, if I understand correctly.
I mean, if you count the training days, I think it's probably since 2002.
So it's almost 20 years, 2 decades
Yes.
that you have been associated and been working on something so passionately.
Right.
What exactly?
My first cleft child is now 15, 16 years old.
Oh,
once
nice.
I treated some way back, so 15 years back, she's grown up to become a 15, 16-year-old girl now.
And how does that feel if she comes up to
Absolutely
you and tells you?
satisfying, and I think the ultimate satisfaction would be once she goes into the mainstream and has a very successful career and a married life. I think I would have achieved my ultimate aim.
So do you think cleft is treatable? I mean, is that like you can cure it or maybe like treat it 100%? Like
Yes.
can a cleft child be organized and perform as good as a normal child in a routine world? Do you believe that? Is that curable in these days?
So sure. So see, cleft, there are a lot of severity of the defects. Majority of the defects of clefts are curable. Okay, are curable.
And just to have this thought in my mind continuously. What actually causes this?
Okay, so one of the main reasons why they attribute it is because during pregnancy, if the mother has not taken folic acid, okay, is one of the causes. Okay, and it's usually seen in low socioeconomic, very poor people. So nutrition is also attributed to it during the pregnancy.
Right.
And because if there's no access to folic acid, that is one reason why the cleft is caused.
Okay.
And there are many other genetic factors. Okay, sometimes you see cleft and in especially in the communities where consanguineous marriages matlab you are marrying within the family.
Oh yeah, got it.
All right, so
genetic deformation.
Somewhere the genetic deformation will show through or express, the gene will express itself. But having said that, there are outliers. We have seen rich families.
Oh, okay.
Not families, though those are not married among cousins, nowhere, having no incidence of cleft for the father or the mother or their parents, any of the father's side or the mother's side.
Okay.
Still, the child is born with cleft. So it's still an enigma. We have identified many genes, but we are still not developed any sort of a vaccine or any preventive measure that like you take a shot of injection or the cleft is avoidable. No.
All right.
So that's
what care can they take? Like suppose you're treated a cleft child. So what kind of advice would you give to parents who are born with a cleft child, and once they're treated, do they need to take some extra care and precautions so that it can be avoided, or like maybe if they are already born?
Talking about during pregnancy?
I think that you already taken up, right?
Yeah.
Like maybe because of nutrition. That is one of the concerns, and it can be a genetic disorder.
Right.
Like, but post treatment, is there like some kind of care that a parent need to take so that this can be like well avoided in the future? Does it happen again?
Once you're born with a cleft defect, I mean you have to only treat it.
And can it reoccur? Is it like once it's treated, it's gone completely?
Yeah,
right?
it's like once the defect is there, what's involved let's understand what's involved in a cleft care. So cleft care is not one person therapy. It is like once a child is born with cleft, the mother is pretty distraught.
True.
And the first thing you do is rebuild confidence and reassurance that your child will be treated if you have the right hands and you bring the child to the right specialist at the right time. And this is very much treatable. Okay. So there are a lot of individuals who are born with cleft and have become very successful individuals in their lifetime. So it's nothing like, it cannot be treated.
Right.
But yes, there are degrees of complications and severities. Most clefts can be treated.
Okay.
And it involves a team.
Right.
So it's not one person job. So you have orthodontist, me, who sees the child right after birth till he's 20, 21 years in, of course, increments. Then you have an oral and maxillofacial surgeon, and then you have, or you have a plastic surgeon. Okay, you need a ENT specialist. You need a pediatric dentist. You need a speech therapist, and you need you need a psychologist as well, and you need a counselor. You counsel
doesn't
because
look like a very affordable solution, but I think
that's why the charitable organizations come in,
and that's why you are also a part of where you take care of such people who come from needy families.
Right, but most of the times cleft children are born in low socioeconomic, and in India, the Ministry of Health, as of now, I don't think so. There is any provision to it's like there's a fund earmarked only for cleft care. So we have this for foreign as well as some of the Indian organizations as well. You must have heard of a Smile Train and Cleft Children International.
Okay.
Cleft Children International is the organization I'm working for. Okay. And so these are the organizations who gather fund for you.
Right.
All right. And then they bring up this team, they set up in a hospital, and it's our job to deliver the treatment.
Nice.
So that's how it goes.
Privileged to have you today, and being so that you are also a part of this committee, and I think you take care of children who are needy, who come from needy families.
Absolutely.
And you do it for...
There are times I've treated them free of cost.
Yeah,
so what has happened is I've written a book on this procedure.
Oh, is it?
Yeah. So the objective of the book was to train the other like-minded orthodontists and postgraduates for this specific procedure called as NAM, nasoalveolar molding. And the sale proceeds from those books I earmark to treat the needy children.
That's a great initiative.
Yeah, so it becomes like perpetual, so if funds are already there, you can, it's not a big way, but then...
anything that contributes to the society, I think it's a valuable contribution.
Yes, at least it's got the wheel spinning.
Yeah. So you mentioned something about when, like, let's not talk just about cleft, but there are a lot of things in and around when it comes to choosing a doctor.
Right.
So, like, how do you choose an orthodontist?
All right.
Like, how do you understand or ensure that the person who is treating you or is getting you the treatment is the right person? So, how do you suggest that, suppose a family who is in need of maybe getting a denture as well, maybe even a cavity treatment or anything, like, who visits orthodontist? How do you choose your orthodontist?
See, obviously, I mean, one of the main referral points is like, you'll ask your family member, you'll ask your friend. It's mainly through strong mouth-to-mouth references.
Right.
And nowadays there is internet. You have Google. You have all the information is there. You need who's the doctor, where is he located, what are people talking about him. So all this information is there. Plus, one other good tip is if you want to really go into the credentials, orthodontics is also a science which is done by non-trained professionals as well. That is a problem which the Indian orthodontist is facing. Okay. That means there are individuals who have gone into doing 1 week courses or 10 days courses or 1 month courses, and then going on to treat people for braces. And mind you, the Dental Council of India, which does not recognize these courses. How do you compare a 3-year training versus a 1 month training? So to find the right set of orthodontists, the Indian Orthodontic Society, which we are largely a group of, there's a website called as bracesspecialists.com. Okay, specialists with the S.
Okay.
And there you can find a doctor, you can locate the doctor, see his credentials, do your due diligence, take some references, and this is how you choose your doctor, how you choose your orthodontist.
Take your point, but do you think the consumer or the patient, let's call them patients these days, or consumers, because they are the ones who are finally consuming your service or maybe the product that you're prescribing, right? Do you think they do that kind of due diligence today to ensure all the things that needs to be taken care of? For example, choosing your doctor.
Right.
Anybody like maybe recommends them, or they see something
They'll
on the internet.
It mostly, yeah.
Exactly. So it's more like an impulse. Like मुझे अभी तकलीफ हो रही है, मुझे एक डॉक्टर चाहिए, सामने मुझे डॉक्टर मिल गया तो मैं go, right? And even in fact for like anything, even for a normal first aid, they don't see अरे डॉक्टर MBBS है, MDA, MS and whatever. So they normally just barge into a clinic if there's an emergency, if there's some kind of urgent pain they have, right? Similarly, like you mentioned that there are some ways that people have been doing short-term courses and they call themselves an expert, vis-a-vis you, where you guys have trained for like 4 years and 3 years of MDS.
Correct. So you
have invested so much time into your education, and now that you do as a part of what you do as a specialist. Do you think advertising is something that has been involved largely in this, where they showcase something which is not right,
Correct.
and in a way try to, like, just to put it short, do you think advertising should be a thing that should be taken, should be involved when it comes to health or doctors? Because I believe it's illegal. I think it is illegal.
No, I mean, see, I'll tell you what. The Dentist Act definitely prohibits us from advertising in newspapers and your cases, displaying your cases or anything of that sort. But the internet marketing is a little bit of a gray area. Okay, so there are no norms or really hard laws that prohibits you from completely that you show yourself on internet in your social media. And then there will be a hard crackdown. We are not sure about that. Okay. Social media is a boon and a bane both. All right.
Right.
It depends on the way you use it.
Right.
So if you're going to show your prowess, and if social media gives you that platform, why not? All right. Showcase your cases. People need to know.
Right.
What are you capable of?
So like a case study.
Like a case study.
You can showcase your case study.
Case studies. And of course, all these pictures, whichever we are going to show on social media, they're given the permissions, the written permissions that you may use our picture, you may use our photograph for your this thing, because they're really happy about it. And there are so many instances. The mothers have actually, post-treatment, this is my daughter got married, this is her picture, smiling picture. If you want to use it for your Instagram, go ahead and use it.
Nice.
So, those kind of experiences you have. And of course, we have to follow this etiquette of, not really going overboard.
Right.
And why not? If there are certain procedures that can be showcased, it dispenses a lot of information for the lay. Why not do it? Because that will actually help the lay person make diligent decisions.
Right.
Okay, so basically, more you know about the doctor and his prowess, the choice becomes very clear.
Right. But the same goes to, like for example, let's talk about orthodontist taking care of braces. I think braces have been there, like even my sister who got treated from issue.
Yeah.
So I remember her wearing it for almost like 1.5 years, and now her smile is great.
Okay.
I think it was before marriage, and she has been smiling really well after that. These days there is this new term called as invisible aligners. Right. And that has now, I think, it's like kind of a rage in the market.
Correct.
But I've seen a lot of advertisements, and that is why I asked the previous question, because invisible aligners have been like a go-to thing in the market. I get calls. I'm not naming the company, but I do get calls frequently. Like, do you want to get a 3D scan at your home? It's free. You'll get it done at your home. Okay. How correct is this? Do you think this is the right way for you to get a liner for yourself? Like let's call it as a DIY, do it yourself invisible aligners.
Right.
So somebody is coming to your home asking for a 3D scan. They'll do a 3D scan and then they'll send you a set of invisible aligners. Vis-a-vis where my sister used to visit you,
right?
All the way from Thane to Kandil, she used to come get it checked every, I think, 1 month. You used to do whatever the treatment used to do on her.
Right.
That is more like what do you say? A specialist is working on something.
Correct.
Vis-a-vis this, wherein a third, some person is coming to your house. I'm not too sure if he's the correct person to do all that scans.
Perfect.
So do you think this is right, or is it legal in a way that, or does the dental society accept this?
Okay, so let me ask this question to you. How comfortable would you be, suppose if you decide to do the treatment, that somebody comes to your house and you're a able-bodied man, and then if it's not like somebody's bedridden or something like that, so how comfortable would you be? So orthodontics it needs a human touch. It needs a doctor-patient interaction. It's an intricate science. Okay, and it requires really good skills to predict movements and to deliver a really good treatment. It's really difficult. Orthodontics is one of the most difficult sciences in dentistry because we have a lot of unpredictable elements here. Okay, apart from the skill, we are dealing with a lot of unpredictable elements, like how much the jaw is going to grow at what age. So these kind of predictions we need to do. How much the teeth would move, whether we don't know whether it is going to move at the right direction, at the right force. So it's an intricate science. So it requires a human touch. It requires an orthodontist at the helm of it.
Okay.
And so orthodontics generally involves, like we usually have, teeth patients coming to us. Doctor साहब मेरे दांत बाहर हैं, मेरे को अंदर कर दो. या डॉक्टर साहब मेरे दांत बहुत टेढ़े मेढ़े, उसे जरा ठीक कर दो. So braces used to be used. It's almost an 80-year-old science.
Yeah.
And traditionally we have been using those braces which come in many metallic or ceramic, which is visible, less visible. And over the years, it has evolved into many other forms. So this aligners is also one of the form, which is the most contemporary form right now.
Right, yeah.
It started its development some 15-20 years back. And it was developed, the science was largely developed in the US. And now the whole world has caught on.
Okay.
So those are called as aligners. It's nothing but a simple plastic sheet which is really transparent, and it's a product of artificial intelligence. That means once the process starts is like, once the 3D scan of your teeth is taken, it's fed into the softwares. The orthodontist or the technician, they starts and planning the treatment for you. Okay. And then it decides from, the machine, the software decides, like, this to move the tooth from here to here, how many steps should we take. It's the orthodontist's job to monitor whether the machine, whatever is decided, is right or wrong.
Okay.
Okay. So this is how the flow of treatment goes in. So it's one of the reasons why it's caught on is because it is non-intrusive. In the sense, nobody will come to know that you have worn aligners.
Okay.
You can still go on and have your treatment. Nobody's invisible. Especially, and it gives you the freedom to eat whatever you want. In braces, you don't have those freedoms.
So you can eat even with the aligners?
No, but you have to remove the aligners, eat your favorite hard food, no problem.
Yeah, that used to be a problem, I think, with the braces. It used to get stuck in your
Correct.
braces.
So braces, there are certain disadvantages as well. You cannot really have really sticky and hard food. You cannot have really gooey stuff. In aligners, of course, you can remove your aligners and eat whatever you want. But aligners also has its disadvantage. It depends on you. If you don't wear it for the specific amount of time in a day, it will not work.
Okay. Yeah.
Okay. So we still don't have that perfect orthodontic appliance, where you have the freedom to wear how many hours you want and still get the result. No.
Okay. And how, as an orthodontist, what is your preference? I mean, do you still prefer a braces, traditional braces, or something like an invisible aligner?
No, if the science is evolved over a period of time, the aligner science. Initially, when we started, we were like told, okay, look, by those experts in the field, you don't touch really complex cases, all right? Really crooked, really complex cases. So now, the science and the artificial intelligence in the softwares have got so intelligent. There are default setups. And then the orthodontist now knows how to manipulate that software to get results even in complicated cases.
Okay.
So the shift is happening, but it's still not 100% shift as of now in India. In Japan and all that, there are clinics where there are like 100% aligners. The braces are not done at all.
Okay.
We'll reach there soon. There are certain individuals who do it here in India. We'll reach there soon.
Okay.
And the shift is happening.
So you do aligners? I mean, is that something that you practice at your clinics?
Yes. So we kind of manufacture our own aligners. It's called Move. The brand is called as Move. And so the advantage is we have all the equipment and the machinery. We have the softwares. And I and my partners, they sit and plan the aligners themselves. And we monitor the treatment. So it's like seen by us, done by us, and monitored by us. Okay. So there is that's how it's a different, because it's called as in-house aligners.
Right.
And there is a doctor element.
True.
So nobody's coming to your house. I'm monitoring you. I'm responsible for your treatment.
Right.
Okay.
Right.
As well as there are certain DIY companies where you may not know who your doctor is. Okay.
Oh, is it?
Yeah, because there's some problem. If there's some problem, probably they'll call on those toll-free numbers. You won't know who's designed your aligners. You won't know who's the doctor who's treating you. They have doctors on the panel, but then there's a shift in doctors.
Okay.
Okay. So in that regard, we have taken care of that because I'm responsible for your treatment. I'll be planning and I'll be delivering those aligners.
Nice.
All right.
So that's like more personalized, bespoke,
For personalized touch.
customized approach.
Customized, and I'll be observing you. I'll be hand holding you.
Right.
You know, I'll be taking you through. I'll be sailing you through the treatment.
And like, is there a cost factor that is involved? Like, do you think braces is cheaper or invisible aligners are costlier? Like, what kind of approach is towards that? I mean, how are patients being using it? I mean, do they prefer a braces because it's cheaper? And can you give me more knowledge about that?
See, braces have been a long time, and now braces have been traditionally cheaper. Aligners are customized. Braces are out of the packet. You just put it on the teeth because they're manufactured in bulk.
Okay.
And aligners are customized. Once it's made for you, it will not fit anyone else. Okay. So yes, there is a cost involved, but the cost factors are coming down. The softwares are getting cheaper. The machines are getting cheaper, and I'm sure in the future it will become at par with the regular braces.
So the software that you're talking about, I'm just kind of creeped my interest that. So is this software being used by all the orthodontists across, or is it like something that has been developed for you, by you? Because it's, again, there's an AI factor involved that you mentioned, that the AI is taking care of it and it needs data to process itself. It's kind of a self-learning machine. Like,
yes.
So how accurate is the software which is based on AI? Because like I said, AI needs data that can be pulled in, and basis which the information can be obviously learned and corrected. The accuracy is not 100%, but since you said that you take care of it yourself, hence the orthodontist has that eye on the software whether everything that has been taken is doing is right.
So I'll tell you, it's like this aligner science was largely developed by this company called as Invisalign, which is based in US.
Okay.
Now the Invisalign is a global company. It has got its operations all around the world. So because of that, then the volumes of cases they've been getting, the machine becomes intelligent with every case.
Right.
So the AI has become very robust and the defaults set into it.
Okay.
So when that happens, so the their software you cannot compare with any other softwares, and obviously it's proprietary. And they're not going to tell you what's it all about.
Right.
All right. So, but then having said that, there are many other open source softwares available. There are many proprietary softwares which you have to buy, and then instead of keeping on an artificial intelligence to do everything like in Invisalign, there are human operators there monitoring the artificial intelligence, whether it's working or not, even for Invisalign. It's us. For in-house aligners, the machine doles out a plan. We can manipulate it. We can make it work the way we want. So it is in the other softwares, to a large extent, the human intelligence is guiding the artificial intelligence there.
Great.
Okay?
I think that has to be the right way about it, because like I said, like you also mentioned, and I also strongly believe, because it's health involved, and you can rely completely on a machine to take care of something that is related to your body.
Right.
So I believe a doctor's touch is very important, and it's concerning that a lot of people are kind of blowing it out of proportion when it comes to advertising and doing it at a mass scale where there's no doctor touch involved. And
true. I mean, doling out freebies, and these are still considered a little unethical by the governing bodies. I mean, there are better ways to put your work.
Right.
All right. If you want to showcase your work, I think you can put it in a much more decent way.
Okay.
This is what I believe in. Rather showcase the work and put your right foot forward.
Right.
Okay. Right. Rather than doling out freebies, and those are.
I know, the cheap marketing tactics.
Yeah.
Coming to the part that you mentioned, that invisible aligners are much costlier as a treatment. Like, how many patients do you see on a regular basis coming for invisible aligners vis-a-vis
with the braces? So now, I mean, initially, when I started my treatment, it was like almost 100% braces.
Okay.
And the shift happened somewhere in 2015-16. And so now we see about 20 to 30% of our patients are seeking aligners. And the remaining, I mean, the shift is still to happen. About 70% is still the traditional braces. Okay. But having said that, that is for my practice, by the way. I mean, I'm sure there are many other practices that have much more greater proportion of aligner patients than braces. but it will happen. The shift is going to happen, and it's going to happen soon.
Right.
With so many companies, so many people giving out in-house with the awareness, with the awareness. I think the people are asking for it. Okay. So it's becoming popular. It is becoming popular. Laymen are demanding for it. So I'm sure the shift will happen soon.
Great. Good to know that. I mean, that is something I think there are people with bigger pockets who can afford this kind of treatment.
It's not really that expensive, if you ask me, because right now if you ask
just
percentage
can
wise,
you give me an example, like maybe for
for
general
example,
treatment, how much would it cost for an year?
On an average, if an orthodontist charges about 50 to 60,000 for regular treatment, this would cost you on the best case scenario, the simplest form, maybe somewhere around 80,000 to a lakh. It can start from there.
So the marginal difference in terms of the starting treatment price, but obviously it depends on the complexity of your
complexity of the case. It can go up to Invisalign. It can go up till it can go for 2.7 to 3 lakhs. Because Invisalign is a US company. But that's how the in-house aligners comes in, where we make our own aligners. It's an economical way of delivering almost similar treatment. So it's a kind of a made in India initiative. Desh ka paisa desh ke andar hi rahe.
So what's kind of
that's minimum,
minimum, right? But suppose, you mentioned 4 years of college, then 3 years of your MDS.
Yeah.
How much money does it involve to get yourself a MDS degree these days?
So no, because if you come from a merit student, then obviously the fees is minimal. You need to be really performing well in your NEET and MDS and all that. Otherwise, capitation, there are a lot of investments. There are good colleges. Of course, it takes a lot of investment. If you want to buy yourself an education, there are good colleges offering that. You don't want to go through the entrance route. Because there are certain private colleges that offer really good courses, but it's for a price. So investment could be anywhere from 15 to 25 lakhs. Okay, but it's worth it. Yeah.
And post that, suppose you want to set up your own clinic. So what kind of investments would that take?
That would probably for the starts. If you're not considering the realty space, about 5 to 10 lakhs. Maximum maybe 20 lakhs.
So max, I think moti figure we can take like maybe 50 lakhs of investment is
required post for kisi ko, if you want to get your person educated for an orthodontics, yes, right. Considering this is post BDS, by the way.
So ideally, now that you mentioned that 12 to 15 lakhs is something that even any orthodontist can make.
Yeah, because there are colleges
ideally,
opened
within
up.
3 years, this is something that you can recover easily.
Yeah, because they can work as an associate, they get paid there. They can go consulting, they can have their own income source from there. They can have a college job. So they will probably have a college job, they'll have a chunk of income from there.
Right.
In the evening, they'll go on consulting and they'll earn a chunk from there. So there are many various options these days. So orthodontics as a profession, wo bhuka to nahi marega. Okay?
Good to know that.
All right? So, and if you do your post-graduation, if you post your BDS, if you want to go abroad or do your MS, like a residency program in US, then there's no stopping you. So those options are also there, where you can actually take a residency program in US. They're expensive programs, but in US you have banks which give you really loan at a very low rate. And you have a fantastic career in US. And the income can go from anywhere from $200,000 to $1 million plus.
Wow.
Yeah. So, but then, it's hard work.
Does a MDS doctor in India can work in US, or does he have to go there?
No, degrees are not recognized in US.
So you have to actually go there and give an exam. Or
exams. If post MDS, if you want to say, okay, now I don't want to study in India, you need to go to US. You need to do your DDS. DDS requires you to give your written examinations, plus there are certain skills and practical examinations. And then after that, if you want to do MS, you can do that. So there you can practice both as a dentist as well as orthodontic science. But if you go after MDS and do only MS, you are supposed to practice only ortho. You can't go and do a root canal there.
Oh, all right.
And only certain states allow it. So you can't really jump from state to state. So there are. I'm not very clear about those licensing exams state to state. But these are the possibilities.
So the possibilities are endless. That is what you just mentioned.
And nowadays with a lot of aligner companies, even if you're trained to use the software of those aligners, you'll get a job somewhere.
Right.
Okay.
Right.
So
So do they have like courses, or is it like self-learned?
There are courses. There are a lot of courses.
Which is certified and acknowledged, accredited by the National Dental.
There are private. Say whenever you buy a software, the company trains you.
Okay.
Then you learn from your peers. You learn from your teachers. It's not like one course that you learn it from. You learn. You operate. You reboot. You course correct. Then you take multiple courses.
Right.
Okay.
So basically, it's a self-learning process.
Self-learning, because as of now, officially, the orthodontic science as a separate curriculum for aligners is not. There is no separate curriculum.
Okay.
Some of the colleges teach you. If not, there are a lot of other avenues, because we never learned it.
Right.
Way back 2002. So we learned it on our own, asking friends, taking courses, making mistakes.
Nice.
That's what's happening.
Great to know that you have evolved yourself, because
it's a need of the hour.
Need of the hour. And
perform or perish.
Exactly. It was a really great discussion.
Thank you,
Dr. Gajanan. I fondly call you Mama, but
you can call me Mama. Okay.
But thank you for coming.
Thank you.
It's been a pleasure. And the kind of discussions we had, I think they were so in-depth, and you gave the audience per se so much valuable discussion. It's like a crash course, right?
Yeah. Orthodontist condensed into 1 hour.
1 hour. But I wish we'll have more discussions on this in the future.
Definitely. Yeah.
I would love to have you on the podcast. Something related to the industry, or maybe some varied discussion. Definitely
some interesting topic.
Interesting topics. I definitely believe we can contribute more. We can't really condense everything into 1 hour.
Certainly.
So there's more to come. And if there's anything you'd like to advise our viewers, you can please take this chance.
So a parting shot, like in the sense, I'd like to warn. I'd like to give some tips for the parents. Okay. For example, whenever you see a child's teeth, it's called as a crossbite. Whenever you see that one of the teeth, the upper teeth, is behind the lower teeth, that should kind of raise an alarm bell for you.
Okay.
That is called as an anterior crossbite.
Okay.
That means something is happening, that the lower jaw is growing more faster than the upper jaw.
Okay.
And that has to be corrected as early as 8 to 10 years.
Okay.
If not, the lower jaw grows really uncontrollably, and it becomes very difficult to correct. So there are certain danger signs, which I advise the mothers to look into your child's teeth. Do not ignore it. Second, when the child is sucking the thumb, first year में बचपन पैदा होने के बाद first year sucking the thumb is okay. It looks so cute. It looks nice. और बेटे का मुंह से अगर thumb निकाला तो रोने लगता है, चूसने दो उसको. But if this habit goes beyond 3 years, you'll have disastrous consequences.
Achha.
Okay, the upper teeth becomes really out, and then it causes another habits. It causes the changes in the jaw. The person can look unsightly. And then at one point in time, it may need surgical corrections. A small, innocent-looking habit has got disastrous consequences. Lastly, अभी you may be hearing incidents. अरे बचपन में ना मैं swing में था, मेरा सामने का दांत टूट गया था, तो मेरे जो दांत टूट गया था तो वो दांत मैंने फेंक दिया. If your child is playing on a playground or is enjoying a swing or or a slide, and if they injure the upper teeth and the tooth falls down, okay, do not read my lips. Do not throw the teeth
with it.
Yeah. All right. Pick that tooth up, wash it with water. All right. Put it in a bag of water, or you can put it in a bag of your own spit. You can spit it in a small pouch. Put this thing. Take that piece immediately to the dentist. Okay. There is good chance. If the tooth is completely out, the dentist may be able to save it.
Oh.
And this is $1 million tip I'm giving you. And because that itself causes a lot of consequences.
Nice. Okay? I didn't know this.
Yes, that's the reason I saved the best for the last.
Thank you. Thank you for that valuable tip. Yeah. I think this is going to help a lot of parents.
Absolutely.
A lot of children will watch this. Does this apply to adults as well?
Adults, I mean, yes, of course. Because what happens if you break your teeth and a tooth completely comes out, do not throw it.
Yeah.
There's a good chance a dentist can fix it. There are means and ways to do that now.
Yeah.
And even if you have a small broken chip, if you can find it, I mean,
Hard luck trying that,
beer
but
bottle
still.
खोलते खोलते निकल गया तो
निकल
बात
गया.
हल गया, पता नहीं दारू के नशे में दांत किधर है. लेकिन if you can find it, to take it to the dentist, it helps the dentist to recognize the color, the texture, the anatomy, and he can recreate it.
Great.
Okay, these are certain things you should know.
Thank you. Thank you for all those valuable inputs.
You're welcome.
It's been a pleasure talking to Dr. Gajanan Shanbhag. I hope you liked this podcast. Please subscribe to the channel Inspire with me, Pratik Pai, and like and share this video with all your friends and families who wish to become an orthodontist like him so that you can earn that kind of money. So, thank you for watching.